We have Dr. Douglas Harrington here at the Calvary Baptist Church in Santa Monica for COVID-19 antibody testing. How are you doing today?
I'm doing great. How about you?
Great. Well, it's been a few months since we've spoke, and testing is on the rise, cases are on the rise, hospitalizations are on the rise. In a quick summary, where is this all heading?
Well, you know, that's a difficult question to answer, but I'm going to do my best. I think it's all fairly predictable. The amount of testing that's being done now is clearly identifying more people who are asymptomatically infected. And I know in the past I've talked about the fact that 40 to 60% of patients who are infected never knew they had anything. That's important because it's also true that even though we have rising cases and there's rising hospitalizations, the population that is ending up in the hospital is usually a group of people that have comorbidities. Something is not right with them. And it turns out that the actual survival rate for COVID is extremely high. If you look at the CDC statistics, the last time I looked, if you're under 69 years of age, it's somewhere in the order of 99.97% overall. If you're under 30, it's even higher, it's 99.99%. If you're over 69 and you are in a nursing home or you have one of the comorbidities, the death rate is significantly higher. And that's the group that we really need to focus our efforts on. Because for most people, this is not going to be, it'll be uncomfortable, but it probably doesn't pose as much of a danger as we thought. But I don't want people to interpret that as me minimizing the seriousness of the pandemic. This is a serious illness and you need to take protective actions. And I'm not wearing a mask because I'm socially distanced from my interviewer and they need to be able to hear me. But I think where we're going is we're getting to a point where we're close to herd immunity. It turns out that in the past I've spoken about the two different types of immunity that your body has. One involves cells that directly attack the virus, and the other involves cells that make kind of like magic bullets that shoot the virus. They're called antibodies. It turns out that the T-cell immunity, that's the one that directly attacks the virus, is very important, and about half the population appears to have T-cells that are already primed to attack the virus. That's good news. That means that from a standpoint of herd immunity, we may be closer than we think. The other thing that I think is very significant, and I think it's an incredible achievement for the accelerated rate of vaccine development, we've had recent reports of 2 vaccines that are over 94% effective. Just to give you a clue, some of the flu viruses are 40 to 50% effective. And normally a vaccine can take 10 to 15 years to develop safety and efficacy data. And in this case, in less than a year, we have probably 18 viable vaccines that will be available sometime in the first part of next year. Once that happens, we do something that accelerates herd immunity. And once we do that, the pandemic will essentially waste away. It'll go away.